Now, whenever I saw the topic of this next interview, of course, my mind actually went back to a Brad Paisley song, but this is actually a very serious issue, the fact that ticks are present in our neck of the woods and Lyme disease very prevalent throughout Pennsylvania. Joining me on the phone right now is Dr. Tom Simmons, a professor in the biology department of IUP who happens to specialize on these topics. And Dr. Simmons, good morning.
Oh, good morning, Josh. Thanks for the invite.
Thank you for coming on the show today. So I said ticks are very prevalent in our area. Just how prevalent?
They are. So in Pennsylvania, let's say about in Pennsylvania, in terms of one of the diseases that ticks transmit, Lyme disease, Pennsylvania since 2011 has reported the most cases of Lyme disease in the country. And of those cases, actually, the majority of those are in the southwest region of Pennsylvania, and including Indiana County.
So we're right in the thick of it then, as far as Lyme disease is concerned.
Yes, absolutely.
Talk about what Lyme disease is. I mean, we know that it's passed on by ticks, but what is it?
So Lyme disease is a bacterial disease. It's caused by at least a group of bacteria. It's are called spirochetes, and another bacterial disease, which is a spirochete that people might be hopefully not familiar with, but know of, is syphilis. So it's a bacterial disease that is spread by a tick bite. And then it causes actually an immune or an inflammatory response in the body, and that results in some of the symptoms that both acute and chronic that people exhibit or have.
I've been taking a look at some of the signs and symptoms on the Centers for Disease Control website. I mean, it is a lot to keep in mind here. I mean, it could range from something small, like you see that bullseye rash, maybe, I think, or it could be as bad as some neuropathies or meningitis or anything along those lines.
Yes, it's what we call like a protein-type disease. It really manifests itself in different ways in different people. So, unfortunately, the classic bullseye rash, that only occurs in about 70, 80, or 80% of people.
Oh, okay.
Yeah. So, if you have it and you have a bullseye rash and you were in a tick in the area that you'd find ticks, or you're bitten by a tick, then you can be pretty confident that you have Lyme disease. But there are a lot of other symptoms, and one of the problems right now is that with this COVID-19 pandemic, a good thing about that is people are rediscovering the outdoors. The downside of that is that people might be rediscovering or discovering for the first time tick bites. And there are some acute symptoms that can kind of overlap between COVID-19 symptoms and Lyme disease. So some of the symptoms I think you just mentioned there are like flu-like symptoms, fever, muscle aches, headaches, and fatigue. That can be caused by both the COVID-19 virus and Lyme disease. But then, of course, there are symptoms that are different. I mean, Lyme disease is not a respiratory disease, and COVID-19 is. So, and then you can have these chronic symptoms if not treated, such as the palsy or swelling of the joints, and maybe even some heart or nervous system problems. But that's typically in people that are infected and haven't been diagnosed or treated.
So it would be to the best interest of anybody that if they do see some of those symptoms, to head over to the doctor right away or give them a call.
Absolutely. Check in with your healthcare provider if you have flu-like symptoms this time of year.
Mm-hmm. So, as we mentioned, it is very prevalent, but let's talk about treatment options. I mean, what would people face if they find out that they get Lyme's disease from a tick?
Well, I think the good news is that if caught early, that it can be easily treated with antibiotics. I mean, typically doxycycline or amoxicillin, or there are other antibiotics. Mm-hmm. And depending on what your healthcare provider decides to do, it's often, if caught early, maybe a couple of weeks on antibiotics. Since it's a bacterial disease, they the antibiotics work pretty well.
Mm-hmm. Now, after the treatment of the antibiotics, would you be likely again to maybe it would become easier for you to pick up Lyme disease again? Because I have heard of like long-term cases of people who have Lyme disease and it affects them for a while.
Yeah, so unfortunately, if you are infected with Lyme disease and you're treated with antibiotic, it eliminates it from your system, but that doesn't give you like immunity in the future. So that bacteria, that spirochete, is pretty tricky in terms of evading your immune system. Those post-treatment Lyme disease symptoms that you're talking about, what some people call chronic Lyme disease, that's for people who were not diagnosed or treated early, and sometimes you don't even know you had a tick bite. So you may not realize you had Lyme disease, and then you could have symptoms a year or two later. And even some people who are treated with antibiotics and eliminates the bacteria from the system, some of those some people still do exhibit chronic symptoms. And we're not quite sure what that's due to. There's some debate on that, but nonetheless, it's real, and it's not easy to treat those lingering symptoms.
Have you been able to track how things have been going with ticks and Lyme disease this year for our area?
Yeah. So actually, I have, unfortunately, COVID-19 has shut down my research program.
Oh, I'm sorry.
Well, that's okay. I mean, it gives me other things to do, at least in terms of my field and lab work with students. So my understanding is this year has been a pretty early season. It was a mild winter, and it was a very wet and cool spring, which ticks really like that coolness and that high moisture and humidity. So nymphs which most cases of Lyme disease are transmitted by nymphs because they're very small, about the size of a poppy seed. They showed up a little bit earlier this year. I know I have neighbors in Indiana that were picking them up and on them in April. So it's sort of an early nymph season. Mm-hmm. Usually nymphs peak, and they probably still will, in June and July. Well, actually, we're in July now.
So it could be a late peak. Who knows?
Yeah, this would be peak nymph season. But, this really dry, hot weather, they don't like that, so they're probably inactive right now. At least their activity is down. Mm-hmm. But as soon as it rains and you get a lot of moisture out there, they'll be up looking for a host or a meal, which could include people.
Well, that's one good thing that can be said for this heat wave that we've been going through then. Let's go into what people should do. Obviously, the best thing they can do is they can check themselves if they're going into a wooded area or anything like that, or if they know if they're going into an area that has a large tick population, they can check themselves. But removing a tick, it's not as easy as many people think. I mean, there's a lot of urban legends and myths roaming around about tick removal. What's the best thing to do?
Yeah, so in terms of when I go out in the woods, either research or even working in the yard, actually most cases of Lyme disease are people get most cases of Lyme disease are from people working in their yards, particularly near wooded areas. But you can pick them up in the parks now. So whenever I go outside, I typically wear long white tube socks, and I wear light-colored pants and tuck them into the tube socks, and then I tuck my shirt light-colored also into my pants. Mm-hmm. So ticks typically crawl up, particularly nymphs. They'll get on your shoes and socks, or if you're kneeling on your knee, and they'll start crawling upward. So it's best to have shirt tucked into pants, pants tucked into your socks. Mm-hmm. And also, you can spray your clothes with permethrin. It's very effective. Some people don't like to use these synthetic type chemicals, but permethrin's very effective in terms of repelling. Or you can use DEET, or you can use some other U.S. EPA registered natural product.
Mm-hmm, yeah.
Yeah. So if you so that's one thing you can do. The other is be aware. Always be checking for ticks on your clothes, and then afterwards when you come inside, throw your clothes in the dryer, take a shower, and do a thorough tick check. If you happen to find a tick, they're actually best way to pull them off is with a fine-tipped tweezers,
Mm-hmm.
and grab them as close to the skin as possible, and just a steady motion away from the skin will pull them out. If they've only been on for a day or less than a day, they come out pretty easily. If they've been out for more than a day, they're a little tougher to get out.
Yeah,
they might even break off a mouth part, but not to worry. If you just put like an antibiotic on there to prevent any secondary infections, eventually your body will just remove it by splinters. But it's not recommended to use kerosene and petroleum and some of these other methods. Really, a fine-tipped tweezers is the best way to do it.
We're talking with Dr. Thomas Simmons of IUP, a biology professor, expert in ticks and Lyme disease, and we've been getting some very good tips on this. Dr. Simmons, how did you get interested in this sort of field of biology, focusing on these two specific areas?
Yeah, so actually, I got into ticks and tick-borne diseases about 7 or 8 years ago. I'm originally from Long Island, so Lyme disease started back on the East Coast. Actually, Long Island, in some sense, was ground zero and across the Long Island Sound in Lyme, Connecticut. The disease is named after a town of Lyme in Old Lyme, Connecticut. So that was back in the early 80s. I've been at IUP now for, I think, 28 or so years. And about seven years ago, I teach a applied entomology zoonosis class, and one Friday afternoon, one of our exercises, we figured we'd go and survey ticks. So we actually went up into White's Woods, and a lot of neighbors were complaining about dogs picking up ticks, about 7 or 8 years ago.
Mm-hmm.
So we split up into teams, and we dragged for ticks, dragging material across the ground, and checked the drag to see if ticks attached. And boy, I think we picked up about in a 3-hour afternoon. The class picked up, I think about 200 ticks. So I was amazed at the numbers, and that really perked my interest.
Wow!
And it's then where I started getting into it. And I work very closely with the Pennsylvania Department of Environmental Protection vector management folks that monitor mosquitoes for West Nile virus, but they also monitor ticks now across the state. And as of this month, actually, in July, my lab will be taking over monitoring of ticks and tick-borne diseases for Indiana County for the state. So we'll start having a better idea of tick numbers going up and down on a weekly basis.
All right. Now, you mentioned a little bit ago that your studies have been affected by the outbreak of COVID-19, and I would assume that you're getting ready once again for classes in the fall, but I imagine classes are going to be a bit different over at IUP, at least for you, when it comes to your work in the biology field.
Yes. It sort of remains to be seen what happens this fall. We all want the students to come back. That's the best way to learn. So depending on how it goes, it might be possible to work in small teams and do some of this work. And I have a couple of students that are actually 3 that are doing research with me, and they're sort of on hold. So we're hoping to be able to get out, and that's a little bit easier when you just have, especially for field work, if there are 2 or 3 students, and you can really spread out and practice the social distancing and masking and all that, and still get some field work done. So, and I'm hoping to have to get permission, but I'm hoping to have a couple of those students help me actually this summer as we start monitoring on a biweekly basis tick populations in Indiana County.
Dr. Simmons, thank you very much for joining us. We've come right up to the marker, but thanks again for joining us. And please, anytime you want to be on the show, let us know.
Okay. Again, thanks a lot for the invite.
All right. Thank you again. Dr. Thomas Simmons, biology professor at IUP here on Indiana in the Morning